Okay, so here we are with Beja and myself. And again, this is a recurring topic. We have been working on this social global campaign for about a year now. We're trying to solve. So there is a functional crisis in America and in the world. Functional disorders includes, for example, fibromyalgia. Have you heard of it?
Yes.
Right?
Yes.
Chronic pain,
Yes.
right? In the neurology service, which I believe you work for neurology, recruiting for neurology. I don't know if you recruit for other specialties too. You can tell me, Beja, when you introduce yourself in a moment. In the neurology realm, these conditions are called functional neurological disorders. But you have it also in other specialties. As I said, for example, fibromyalgia, the rheumatologists see them,
Hmm.
right? If you have chronic pain, it's usually the pain management who sees, but the neurology is there, right? Because it's a primary, all those conditions are primarily neurological. Why? Or have a big neurological component. Why? Because the brain is what perceives sensation. So when it hurts, being it fibromyalgia or being it pain, it's the brain that is intervening in all that. And then when you look at functional neurology, then you have, for example, functional seizures, you have functional neuromuscular, you have functional movement disorder. So the functional neurology expertise blends with all the other subspecialties. Am I making sense?
Yes. Yeah.
Okay. So now tell me and tell us a little bit about you, about whether be, and how do you think we could partner up in matching the functional experts? I am one of the few that exist in the United States. I mean, we're a very small niche, but we are doing work to train other neurologists for them to come into this field. We're also, we as a company, I'm talking about our company, we are Science and Shamanism, we are training PAs, so APPs, the
Hmm.
advanced practice practitioners. We're training the physician assistants or PA. We are training the nurse practitioners or NPs, and so on. So, with this small background, if you want to tell us about you, about your company, and where are you in this kind of new field, and where do you think you can position in these initiatives and in the real world of recruiting for this work?
Yeah. My name is Beja. Work with Weatherby. I work specifically with neurologist. I guess Dr. Velazquez, because I'm not super familiar, because as you had mentioned, this is an emerging subspecialty. Um, when did you transition more into functional neurology? And is it a fellowship path, or is it something that you've kind of gained experience as you've been working as a neurologist?
Yeah, good questions. So, I mean, these conditions have been around for like thousands of years, hundreds of years, since Egyptian times, little by little, like having their own movements. Now, in modern times, since the pandemic, there was a huge increase in mental illness, in functional illnesses, right? Because functional disorders, they happen when there is a dysfunction. It can be emotional, it can be cognitive in the way we look at the world and we use the cognitive mind. It can be physical, so certain physical pathways of pain and sensation. And it can also be spiritual. So people disconnected from their mission and they don't have energy to like pursue anything. They go on disability, they cannot work. There was like a crisis that happened during the pandemic. And that's when I decided decided to dedicate my career full time to it. Now, before I had functional symptoms for the first time in medical school when I was 19 or 20. It was third year of medical school. So I've always had my eyes on it. And actually, migraine headaches
Hmm.
have a big functional component. The headaches in general have a strong functional components. I have had migraines throughout my life. So I have always been reviewing this literature, doing self-study, self-understanding, self-investigation. And then I am a specialist in clinical neurophysiology.
Hmm.
If you look at this name, neurophysiology is the study of the functioning, the physiology is the functioning of the nervous system. So I have always been right
Hmm.
around that. And for 5 years, I have been fully dedicated doing research, doing education, consultant work, locum tenens, and working with various hospitals and private facilities. The goal is to, yes, work for them, but then to train them, to train the staff and to make them independent, because it's a big problem in America. We have hundreds and hundreds of private practice and also teaching academic hospitals that we have to help. So I
Hmm.
cannot sign up for one position. So I'm looking constantly to help new and new practices. There is no fellowship, official fellowship training available that I am aware currently and specialized in any hospitals. But like new fellows are starting this August, September. So I
Hmm.
am not sure if this year any hospitals, like we have some big facilities like the Mass General,
Yeah.
Cleveland Clinic, right? John Hopkins. These facilities are trying, right? They are in the forefront of all this. So I am not sure if any of those are putting a fellowship together. I believe not, because we had the international conference just 2 months ago and no one announced, hey, we have the first fellowship program
Uh-huh.
worldwide. No one said that, right? So, and it was in America. It took place in Baltimore. So I don't think so. That's something that we could work together on. What does Weatherby you think would like to do? And I would like you, Beja, to think big, to be
Hmm.
ambitious, because and you're 26. I mean, you have like a whole life ahead of you. You can be the head of a department. So, what do you think with my answers? Where are you seeing yourself? Where are you vibrating in this whole market?
Yeah. So from what it sounds like, would you say that mainly you guys are focused on kind of the outpatient side of it all?
Yes, so the largest proportion of this population go to the outpatient
Hmm.
side. Yes. But there is a significant proportion that presents to the emergency room and they end up being hospitalized, but it's a smaller proportion.
Hmm.
But my company, Science and Shamanism, which is the educational piece of my work, and also we do research through the company. This also teaches emergency room physicians. We train them, we work with them, we go to the emergency room and we spend there working together 2 to 3 months until we map out the situation, until we train the providers in the hospital, until we decide if we are going to offer fellowships or offer neurology training to the emergency room as an
Hmm.
established. So larger outpatient, a
Hmm.
small but important proportion also inpatient.
Okay.
Am I making
And
sense?
yeah, and the one other question that I do have is, um, what is kind of the explicit differentiating factor between you as a functional neurologist versus like even just a general outpatient physician that's also seeing a lot of the same conditions in the outpatient setting?
Wow, you're asking really good questions. Yeah, yeah, it's like well thought and very um deep in the knowledge that you're bringing forth. So about 60%, 60%, 6 out of 10, the majority of patients that come to the outpatient have some functional component.
Mhm.
So movement disorder specialists are seeing it. Headaches are seeing them. Epileptologists are seeing them. So what is the biggest difference? I know how to diagnose them. I know how to treat them. I even developed a new methodology that I am publishing now that I have been testing for 5 years. It's integrative, it connects it all. It's very simple for physicians and trainees to learn. So the difference is that I know I am comfortable. Remember, I told you, functional disorders can be emotional, can be
Mhm.
mental, can be physical, can be spiritual. It can affect all the functioning of all the brain capacities. So these patients are complex, right? Many physicians, many neurologists, they want to, the easy bread and butter. Like, who wants complex patients? Right. So the difference is that I'm very comfortable. I love this population. So what I do is I help other subspecialties within neurologists to become comfortable with it. Because why are we uncomfortable? Why don't we want to treat them or get involved? Because we don't know the easy way of doing it. Because we don't have training. It goes back to your first question. We
Mhm.
don't have fellowship training. So my poor colleagues, my poor partners, they are very uncomfortable. And then they don't have the knowledge, they don't have the skills. And then the patients come and the patients are poorly treated. So what do you think we can do about this, Beja?
Y- Yeah, so I know that a big focus on my team recently has been breaking into a lot of these, I guess, up and coming subspecialties. Like I know cognitive neurology, for example, that's a super big one with all the infusion treatments that are going on. So that's another market that we've been looking a lot into. And I know that there's a growing need for neurology specifically, as the population is shifting towards honestly older in age patients. So what we've been really heavily focusing on is breaking into these more private practices or group practices, to bring them kind of physicians that can oversee all of these patients. I know the biggest population or areas that are in need right now are rural. I'm not sure, with your specific company where you guys have, I guess, broken into yet, or if you guys mainly are focused on the academic research centers, or if you're looking into expanding into different markets, I guess.
Yes. Yeah, no. I mean, we don't discriminate, right? I don't.
Hmm.
And life played out in a way. I am not married. I don't have any children. I am a world traveler.
Hmm.
So I would be very, very happy to sign up little contracts or determine various collaborations. I think a minimum of 3 months is needed to train, to work together, to learn, to see, to hire someone who can be there full time. Because as I said, I cannot be full time with any practice because our mission is to solve the national problem. But you could be, and also we could do hybrid these days. How
Hmm.
much, right? Online, we could treat patients online, we could do research online, we can train professionals online, we could bill for their practice online. And the model I have developed is heavy in group therapy, in group education. So we
Hmm.
can target large chunks of the population. And one way of solving the deficit of neurologists is providing care at various institutions and various practices at the same time. Imagine I can do 2 hours of clinical care with large groups for practices, and I could have 5 or 10 practices at the same time. That would be 10, 20 hours of my week only. With
Hmm.
20 hours, I can target 10 practices online. So, I mean, we can get very creative, Beja,
Hmm.
very creative. And then what we do is you and I can jump on little meetings, 15, 20-minute meetings with the leadership of these practices, being academic, being university hospitals, or being private practice, rural in any state. And this is why I want to partner with you because you are all over America.
Hmm. And I know you keep mentioning like how many other functional neurologists or what does your team look like currently?
Yes, we are in training.
Hmm.
The other because remember the model has been created by me alone. We have been doing research for 5 years. Over the past year, I have been training other providers, not only neurologists. Since functional neurology and functional disorders in general include mental, again, mental, emotional, physical, spiritual. I am training currently physical therapists, occupational therapists, psychology, psychiatrists,
Hmm.
PAs, NPs. Anyone else? Oh, and then we have like school teachers that we're training because we're also doing prevention. We have a
Hmm.
sector, a branch that works on prevention. So we're working with the school teachers. We're partnering with various spiritual organizations because the research is showing that some of these patients can manifest with some kind of a spiritual and mediumship skills, and they end up going to churches.
Hmm.
And in churches, they are trying to help with addiction. They are trying to help people go back on their work. So, I mean, it's very, very broad, our work. But I have to double check with our network. I don't know who will be willing to become teachers already as of September because we go on uh a yearly rotation from
Hmm.
September to September. So, but as of now, I am the main educator. My troops, I'll have to double check with them to see who will be teachers in September. And then we
Hmm.
will have to talk to them to see, okay, are they gonna, because for a physical therapist, for example, they do more hands-on. Where are our physical therapists gonna go and teach? Well, okay, let's talk to them. There are
Hmm.
two other neurologists in the team getting trained right now. I don't know. We have to talk to them independently. So little by little, but you can count me in as a fully devoted. As of September, I'm looking for new positions to train new neurologists. We're looking for the next wave.
Okay. Because I know my team specifically, we focus on neurologists. So that's the only reason I was asking kind of what your split or I guess setup looks like.
Yeah, so I guess I will refrain from telling you about the other like physical therapy, occupational therapy, APPs because you are not doing who is hiring, who is matching for them, who is recruiting for them? Do you know? I haven't asked them.
Um, I actually am not 100% sure. I know that Weatherby specifically focuses on MDs and DOs. We did used to have a specific nursing team. I know that they got absorbed recently. But I want to say there is a team specifically for A APPs and NPs that are specialized. Because somebody I trained with when I first started at Weatherby, she assists with mid-levels for neurology, cardiology, and one other subspecialty.
Okay, so and if we decide to work together, you and me, and continue moving forward with this initiative and matching and pairing and training and doing whatever we want to do, then we will slowly be bringing to the conversation key players from your team as you discuss it over there, and key players from my team as I discuss it over here. I mean, It's our first conversation. I think we both are ambitious and ready to go. Okay, anything else in the last 5 minutes?
That pretty much answered all of my questions. Like I mentioned, as we've been partnering and trying to break into all of these new emerging subspecialties, I can't promise I'll have anything that comes up quickly, but I am specifically physician side on my team, and then the other half of my team is clinic and hospital recruiting. So what I can do after this conversation is just even ask some of them, hey, I had this conversation this morning. What are your thoughts? And then we can potentially go from there.
Awesome. Yes, and I'm gonna send this for uploading. It usually takes 48, 72 hours to be ready for you. And then when I get the link, I'll send it to you.
Okay.
And then I'll send you a couple of articles that we have published talking about this emerging and the training of the providers and how to solve this. And then I'll send you a couple of proposals that you could actually send to practices, and I could send you my CV as well. And this is
Okay.
going to be online for you to distribute to make it clear because you asked wonderful questions. So I'm so glad that we recorded this. Anything else before we close? I'm so happy, so
That,
grateful.
yeah, this was great. I'm glad we got to connect even with the time difference.
Yes, thank you so much for your flexibility. It's a couple of
Yes,
hours
of
earlier
course. No,
compared to what
no.
we were
All
thinking. Thank you
good,
so
all
much.
good.
Yeah, blessings to you. We are connected. You have a wonderful
You too.
day.
You too. Bye.
Bye.